Welcome back to Normal Cavities, continuation of LA. Today we will be discussing techniques for LA. The first thing is you have to position the patient at 30° in vertical during giving local anesthesia. Why? Because if the patient sit upright, it will increase the chances of fainting. The technique is, first you have to dry the mucosa. Apply topical analgesia. Wipe the excess and then stretch the muscles. Why we are stretching the muscles? Because it is easy to insert the needle in taut mucosa. It is easy to insert the needle in taut mucosa. After stretching the muscles, you have to insert the needle, and then if bone is contacted, then you have to withdraw. First you have to insert the needle, and if bone is contact, then you have to withdraw. Then again reposition the needle and aspirate. What is aspiration? You have to check either the blood is coming or not. If the blood is coming, then you have to reposition. It means if the aspiration is positive, you have to reposition the needle. If it is negative, then you will continue your process. After aspiration, inject the solution slowly, 1 minute for 2.2 ml. Insert 2.2 ml for 1 minute. Then there are different techniques which are performed. First is infiltrative anesthesia. It can be buccal, it can be palatal. Infiltrative anesthesia can be buccal and can be palatal. In buccal, it causes pulpal anesthesia in maxilla and anterior segment of mandible. Anterior segment of mandible, the buccal one. And the local anesthesia that we give it is supraperiosteal. Supraperiosteal. We can give buccal artican, as we discussed in previous lecture, which is the alternative for inferior alveolar nerve block. And what will this buccal artican do? This will anesthetize the lower permanent molars. So the infiltrative anesthesia is divided into buccal and palatal. The buccal is given periosteally. It anesthetizes the maxilla and anterior segment of the mandible. And buccal artican, which is given, it is the alternative for inferior alveolar nerve block, which anesthetizes the lower permanent molars. Then the palatal anesthesia. Palatal anesthesia is painful because the mucosa is hard. So the topical anesthesia is given in a cotton wool and applied. First we apply the topical anesthesia by help of the cotton wool, and injection is inserted beside that. It can also be given by CCLD, computer controlled local anesthetic device. And in palatal anesthesia we use 30 gauge short needle. 30 gauge short needle which is parallel to the mucosal surface. And remember that palatal anesthesia is painful. Then the other type of infiltration is papillary infiltration. The name is suggesting that it will be given in papilla. Papillary infiltration. Now, papillary infiltration is used to decrease the discomfort of palatal injection. You have first approached the palatal mucosa and then what you have to do, first you have to approach the palatal mucosa and then you have to anesthetize the papilla. Then you have to anesthetize the papilla, both mesial and distal, and the injection should be 90 degree to the surface. In this we use ultra short needle of 30 gauge, but it is ultra short. In in palatal anesthesia we were using only short, and in papillary we are using ultra short needle with 30 gauge, 90 degree to the surface. First we have to approach the palatal mucosa and then we have to anesthetize the buccal interdental papilla. We will anesthetize both mesial and distal papilla. Now there is regional block. Now regional block. As the name suggests, it will anesthetize any region. So the example of regional block is inferior alveolar nerve block. Inferior alveolar nerve block. It is easy in children because inferior alveolar nerve block is easy to give in children as compared to adults, because in children the mandibular foramen is lower. Mandibular foramen is lower and the posterior to occlusal plane. It is lower plus posterior to occlusal plane. So the inferior alveolar nerve block is easy to give in children because of this reason, because mandibular foramen is lower and posterior to the occlusal plane. What is the technique of inferior alveolar nerve block? First, you have to go from opposite teeth. And which opposite teeth? Primary molars. For example, if you are, this is left side and this is right side, you want to anesthetize the left side, you will approach from the primary molars and the injection will be 5 mm above occlusal plane. You will approach from primary molars. The needle should be 25 mm in young patient, and in old patient the needle should be 35 mm. Why? Because in old patient the needle should be inserted 25 mm and in young patient the needle is needed to be inserted 15 mm. So in the bone the needle will go 15 mm and in old the needle will go 25 mm. So in young patient you require 25 mm needle and in old patient you require 35 mm needle. Then after injecting, if angle of injection is too obtuse, then you will hit the bone early. And if you are hitting the bone early, that means the anesthesia will unsuccessful. So what you have to do, you have to pull back again, you have to reposition and advance toward the medial border of the ramus. So this is the technique of inferior alveolar nerve block, and it is a type of regional nerve block. Then comes the long buccal nerve block. Long buccal nerve block. In long buccal nerve block, we inject 0.3 mm solution. Then mental and incisive nerve block. Mental and incisive nerve block. The mental just anesthetize the soft tissue, and the incisive nerve block anesthetize the premolar as well as the first molar. It is given in buccal sulcus. The incisive and mental nerve block is given in buccal sulcus to anesthetize the soft tissue and premolar and first molar. or we can say first and second primary molars. It is given in buccal sulcus between first and second primary molars. Then there is ASMA. It means anterior superior middle anesthesia. So what it do, it anesthetize the maxillary, premolar or either primary molars. Primary molars to incisors, either maxillary premolar, either from the premolar to the incisor, anterior superior middle. Then there are different doses. Most commonly lidocaine is used for ASMA, 2% lidocaine with 1:80,000 epinephrine. The adult dose for ASMA is 1.4 to 1.8 milliliter, and in child it is 0.6 to 1 ml, and at the rate of 0.5 milliliter for 1 minute. You have to inject 0.5 milliliter for 1 minute.